Welcome to the Health Headliner podcast by Tudu Digital. Our content is informational only and not medical advice. Please consult your provider. Now, let's dive into today's headlines.
Curious minds to another deep dive. Today, I want you to maybe take a second and picture your morning routine.
Yeah.
Perhaps you're already there, cup in hand, or maybe you're just about to pour one.
Mm-hmm.
But for so many of us, that first thought often goes right to that beloved cup of coffee.
Mm-hmm. It really does.
It's more than just a drink, isn't it? It feels like a ritual, sometimes a comfort, definitely that daily kickstart, almost like a personal statement about how we're facing the day.
Absolutely. And, while we mostly think about coffee for that energy boost, or maybe just because we love the taste, there's actually a surprising new angle here. Recent research suggests that how you drink it, what you add to it, might have some pretty big long-term health effects, way beyond just the buzz.
Right. So it shifts the whole question from if you drink coffee to how. And that's exactly what this really interesting new research from Tufts University gets into. It was published in the Journal of Nutrition.
Yeah, it's quite something.
And here's the kicker, right up front for you. This big study found that the health benefits we often hear about with coffee, they seem to largely disappear, maybe even get canceled out if you add more than just a little bit of sugar and saturated fat.
Exactly.
So our mission today is to really unpack these findings, understand what's going on, and figure out what this actually means for you and your daily cup.
So let's talk about what the researchers at Tufts are really trying to figure out. I mean, we've heard for years that coffee might be good for you, right? Lower risk of type 2 diabetes, maybe some cancers.
Mm-hmm. Lots of headlines.
Yeah, but what wasn't totally clear was how adding sugar, adding cream, things lots of us do every single day, how that changes the equation. Does it affect those benefits? That's what this study really wanted to pin down, especially looking at mortality risk.
And they tackled this with a massive amount of data, which is, well, it's pretty crucial if you want solid conclusions.
Oh, definitely.
They analyzed data from the National Health and Nutrition Examination Survey. People usually just call it NHENS.
Right, NHE.
And this wasn't just a one-off survey. It spanned almost 2 decades, from 1999 right up to 2018.
Wow.
Yeah, and it included a huge nationally representative sample. We're talking over 46,000 U.S. adults aged 20 and up. That's a lot of coffee drinkers to look at.
That is a huge sample. And the way they got the information was through self-reporting. Participants basically had to recall everything they ate and drank over a 24-hour period. That was their first day dietary recall.
Okay, self-reported. That's always something to keep in mind, but with that sample size.
It helps. Now, they categorize people based on whether they drink coffee caffeinated or decaf, and then, crucially, how much sugar and saturated fat they added.
Right, the additives. That's the key part here. So how did they define low amounts? Because low can mean different things to different people.
They were very specific. For added sugar, low meant under 5% of the daily value. That works out to about 2.5 grams per 8-ounce cup.
2.5 grams. Okay, help me picture that.
It's roughly half a teaspoon of sugar. So, granulated sugar, honey, syrup, anything like that counts.
Half a teaspoon. Wow. I mean, I suspect a lot of people, myself included sometimes, probably go over that without even thinking.
It's easy to do.
Okay, so if you're adding more than that tiny bit, you're kind of moving out of their low sugar group. What about saturated fat?
Same idea. Low saturated fat was also defined as 5% of the daily value. That's about 1 gram per 8-ounce cup.
1 gram. Okay, what does that look like in terms of, say, milk or cream?
Well, think about 5 tablespoons of 2% milk, or maybe 1 tablespoon of light cream, or just 1 tablespoon of half and half.
Okay, so again, not very much at all. If you like your coffee quite light or creamy,
you're likely exceeding that low threshold pretty quickly. Yeah, this study really sets a strict definition for low.
It certainly does. And what were they actually measuring? What were the health outcomes they tracked?
They were primarily looking at mortality. So death from all causes, but also specifically death from cancer and death from cardiovascular disease. They tracked this over a long period.
Right, so they followed these thousands of people for, about a decade on average?
Yeah, the median follow-up was between roughly 9 and 11 years.
Okay, so after all that tracking, what did they actually find? Was coffee linked to living longer?
Well, yes, they did find that drinking 1 to 2 cups of caffeinated coffee per day was linked to a lower risk of death from all causes and also a lower risk of death from cardiovascular disease. So that part kind of confirms what other studies have suggested.
Wait, that sounds familiar. But then comes the twist with the additives.
Exactly. This is the really interesting part. Those benefits, They were specifically seen for black coffee and for coffee with those low levels of added sugar and saturated fat we just talked about.
Ah, okay.
For people in those categories, there was a 14% lower risk of dying from any cause compared to people who didn't drink coffee at all. That's not insignificant.
14% lower risk.
Yeah.
But only if it's black or has very little added.
That's what this data showed. And importantly, they explicitly stated that the same link was not observed for coffee that had high amounts of added sugar and saturated fat.
Wow. So adding that stuff seems to just wipe out the benefit.
It appears to counteract it, yes. It really highlights how much those additions matter. It could turn something potentially helpful into something neutral, or maybe even less helpful health-wise.
That really does change the conversation around coffee, doesn't it? What about the amount? Did they find an optimal number of cups?
They did look at that. They found that having at least 1 cup a day again, plain or low additive coffee, was linked to a 16% lower risk of all-cause mortality.
16% for 1 cup.
And if you went up to 2 to 3 cups a day, that link was slightly stronger, maybe around a 17% lower risk.
Okay, a small bump.
But, and this is interesting, going beyond 3 cups a day didn't seem to add any more protection against all-cause mortality. And in fact, the link between coffee and a lower risk of dying from cardiovascular disease actually seemed to get weaker at those higher consumption levels beyond 3 cups.
Huh. So maybe moderation is key, even with the good kind of coffee.
It seems that way based on this data.
And any link found with cancer deaths?
No, actually. The study didn't find any significant links, positive or negative, between coffee drinking, however it was prepared, and cancer mortality.
Okay. And what about decaf? Did that show any benefits?
Also, no significant associations found for decaf. But the researchers themselves pointed out that this might just be because not that many people in the study drank decaf regularly.
So maybe not enough data to really say for sure about decaf?
Exactly. It makes it hard to draw strong conclusions just from this particular study when the consumption is low.
So, backing up a bit, why might coffee, the plain stuff, anyway, be beneficial? What's the theory?
Well, the paper itself talks about bioactive compounds in coffee. Things like caffeine, which we all know, but also stuff like chlorogenic acid and polyphenol.
Right, I've heard those terms, antioxidants and things.
Precisely. They have antioxidant properties, which help protect your cells. They also have anti-inflammatory effects and maybe even some anti-carcinogenic properties, meaning they could potentially help fight cancer development. These are pretty powerful compounds.
But the study's suggesting that if you dump in a lot of sugar and fat,
then the high calories and maybe other effects from the sugar and saturated fat might just cancel out or counterbalance those potential benefits from the coffee compounds themselves.
it's a balancing act. And just to give people context, did the study say how much sugar and fat the average American actually puts in their coffee?
Yeah, they did provide that context. They found that among the U.S. adults in the study, the average added sugar per 8-ounce cup was about 3.24 grams.
Okay, 3.24 grams. That's already over the 2.5 gram low threshold.
It is. And the average saturated fat was 0.52 grams per cup, which is roughly half the low threshold of 1 gram. But still, you can see how easily people might exceed these low amounts on average.
Yeah, absolutely. So, okay, let's pivot to the implications. What does this all mean for you listening right now, thinking about your coffee?
Well, I think the big message is that this study really shifts the focus. It's not just about drinking coffee, it's about how you prepare it. What are you putting in that cup?
Right. It moves beyond a simple yes or no on coffee.
Exactly. And it connects directly to the fact that, let's be honest, a lot of us add quite a bit of sugar, cream, milk, whatever to our coffee.
Guilty as charged sometimes.
Yeah. And this research strongly suggests that doing so might actually be undermining the health perks that the coffee itself could offer. It makes you think about those little additions.
The senior author, Fang Zhang from Tufts, put it really well. Do you have that quote?
I do. She said, "Coffee is among the most consumed beverages in the world, and with nearly half of American adults reporting drinking at least 1 cup per day, it's important for us to know what it might mean for health."
Makes sense.
The health benefits of coffee might be attributable to its bioactive compounds, but our results suggest that the addition of sugar and saturated fat may reduce the mortality benefits. Pretty clear summary.
Yeah, that nails it. And the first author, Bingji Zhu, added something important too, didn't she?
Right.
How unique this study was.
She did. Zhao noted, few studies have examined how coffee additives could impact the link between coffee consumption and mortality risk, and our study is among the first to quantify how much sweetener and saturated fat are being added.
So actually putting numbers on it.
Right, and then Zhao connected it back to broader advice. Our results align with the dietary guidelines for Americans, which recommend limiting added sugar and saturated fat. So it kind of reinforces that general health advice we hear about cutting down on added sugars and unhealthy fats, not just in coffee, but across our whole diet.
It really brings it home how those small, everyday choices, like how you take your coffee, fit into that bigger picture of dietary patterns.
Definitely.
Now, we should be fair and talk about the study's limitations, too. No study is perfect.
Absolutely crucial. First off, this was an observational study. That means it can show links or associations between things like drinking black coffee and lower mortality risk.
But it can't prove cause and effect.
Exactly. It doesn't prove that the black coffee caused the lower risk, just that the two things were observed together. It highlights a correlation, not necessarily causation. There could be other factors involved.
Okay, good distinction. What else?
Well, we mentioned the self-reported data earlier. Relying on people's memory of what they ate and drank always introduces potential errors. Maybe you forget that extra sugar packet, or maybe yesterday was unusual compared to your normal habit.
Right. Recall isn't always perfect.
No. And that kind of noise in the data can affect how precise the findings are. Although, again, the huge sample size helps to balance that out somewhat.
And we already touched on the decaf issue.
Right. Just to reiterate, the lack of clear findings for decaf might simply be because not enough people in the study drank it consistently. So we can't really draw strong conclusions about decaf's health impact, positive or negative, from this specific research.
So it's not saying decaf is bad, just inconclusive here.
Precisely.
Okay, so wrapping this all up, what's the core message from this deep dive? What should people really take away?
I think the main takeaway is that your coffee choices, especially around those additives, the sugar, the cream, the syrups, might matter more for your long-term health than you realize.
It's more nuanced than just coffee, good or bad.
Much more nuanced. It's really about being mindful of what you're putting into that cup. Viewing it not just as, a caffeine delivery system, but as a small, consistent part of your overall diet. The way you prepare it seems key to whether you get those potential health benefits.
It definitely makes you pause and think, doesn't it? It leads to that question. What other seemingly small habits in your day might actually be telling a bigger story about your well-being?
That's a great way to put it.
Whether it's that splash of cream, the extra sugar, or maybe something else entirely, these little daily choices really do add up over time. They can subtly shape your health journey in ways we might not always appreciate. This study is kind of a nudge to reflect on that compounding effect.
It really is. The data makes a strong case for looking closely at those everyday rituals and the small decisions that contribute to our health over the long haul.
Well, that's all the time we have for this deep dive. We hope this look into coffee, cream, sugar, and your health has given you some food for thought, or maybe drink for thought, something to mull over with your next cup anyway. Join us next time as we dive deep into another fascinating topic.
Thanks for tuning in to the Health Headliner podcast by To Digital. Like and subscribe for more health news and breakthroughs. Stay healthy and informed. See you next time.